We have the prone position, and with this position, notice that our patient is lying flat on the abdomen with the leg extended, and the head can be to either side, the right or the left. Now, if you're having problems remembering this position, look at that word prone. In that word, we have the word on, and then we have the letter E. So remember that the patient is lying on their esophagus and entrails. So what is this position used for? It can be used for spinal surgery, and it can be helpful for patients with certain respiratory problems such as ARDS and COVID-19. So we've always had the prone position, but it seems like over the recent years since we went through the pandemic, this position has started gaining a lot of attention because COVID patients, they have found that it's actually improved their lung status because this position, proning, can actually move those lung secretions. It can improve gas exchange and ease that workload on the heart. However, there are some problems with this position that you definitely have to monitor for. So if your patient is proning and they have mechanical ventilation, they have a tube in, you got to make sure you're monitoring that airway because that tube could come out or it could become blocked. Plus, we have their head turned certain ways where we're putting a lot of pressure on the ears. It could break down the ear, leading to a pressure injury. And the eyes, we got to be really careful about the eyes that we don't put too much pressure on them and damage them. Plus, up here on this area, you can develop a brachial plexus injury because those nerves can become damaged. So it's very important we're making sure we're not putting too much pressure on that area. Okay, so that wraps up this video, and don't forget to check out the other videos in this series.